I'd like to talk to the guys out there. One of the realities with diabetes is that we have a higher chance of developing erectile dysfunction. A lot of different reasons why that occurs has a lot to do with cardiovascular disease, sometimes neuropathy that can go with diabetes. But what's really important, guys, is that if you are experiencing this, the worst thing you can do is to not talk about it with your physician. Because if you do that, you're just going to remain frustrated. You're not going to have any chance at dealing with the problem. And the good news is, guys, that there's a lot of ways to deal with the problem. There are some pretty interesting technologies. We've all heard about Viagra and some of the oral agents that allow you to get a much more satisfactory erection. These things really work, and there's lots of options. The only way you get to those options is by telling your doctor about it. You have to be upfront and say, this is starting to happen to me. You'll be amazed at the odds and opportunities that you'll have. But if you say nothing, you get nothing. Brings up another topic. This is for now all the women. You can listen in now again, and the guys too. Medications that we are all prescribed for our diabetes have different kinds of impacts on everybody. Some people get sick to their stomach with things. Some people have diarrhea. There could be complications. Some of them are expensive. As a consequence, a lot of people with diabetes don't take their medications as they're prescribed by their doctors. One thing I know is absolutely gospel fact, right? And that is medications don't work if you don't take them. And unfortunately, the literature shows that many, many people with diabetes don't always take their meds that they're prescribed. A lot of reasons for that. They're too expensive. If they're too expensive, talk to your doctor. See if there's a generic alternative that's much cheaper. Sometimes there's a side effect, and you don't want to talk about the side effect with your provider. Maybe you're embarrassed by the side effect by your provider. Blood pressure medications, for example, could cause erectile dysfunction, but not all of them do that. You switch to a different one, the problem goes away. But if you don't discuss why you're not taking a med, you're never going to find an alternative to that. A lot of people don't take the meds because they say, I don't feel different. Why should I take a medication for my cholesterol levels? I don't feel any different. It's expensive. Well, the reason is because frequently people with diabetes also have cholesterol problems. And if left unchecked, those things cause heart disease, the leading cause of death in people with diabetes. So you need to talk to your healthcare team about your medication. If you don't like it, if you're not taking it, talk to them about it. Be forthcoming. They will work with you to find a better solution.